The Empire State Building towering over a grateful city of New York tonight, displaying the colors of the FDNY and New York City EMS. Good evening on this day, 1191 of the Trump administration, 193 days remaining until our presidential election. The president started today's White House briefing touting his administration's success in the fight against the coronavirus. One of the first things he said was, the whole world is watching. And let's stop right there, because he's right, but maybe not in the way he meant it. Because by tonight, much of the world had caught up with the fact that just yesterday, he said this from the podium in the White House.
Supposing we hit the body with a tremendous, whether it's ultraviolet or just very powerful light, and I think you said that hasn't been checked, but you're going to test it. And then I said, supposing you brought the light inside the body, which you can do either through the skin or in some other way. And I think you said you're going to test that too. Sounds interesting. Right, and then I see the disinfectant where it knocks it out in a minute, 1 minute. And is there a way we can do something like that by injection inside or almost a cleaning? Because you see it gets on the lungs and it does a tremendous number of the lungs. So it'd be interesting to check that. So that you're going to have to use medical doctors with. But it sounds interesting to me.
Those words about inserting UV light into the human body, about injecting disinfectant into the human body, established a new benchmark of sorts in the history of public utterances by our presidents in that House. And consider for a moment the fact that we are in the midst of a pandemic with over 50,000 dead. His words were greeted with revulsion and downright anger on the part of healthcare professionals. His words caused a spike in calls to poison control and to a lesser degree launched 1,000 jokes and memes that continue tonight. And it's clear this one will stay with him forever. So perhaps because the whole world is watching, when Mike Pence was done after delivering the day's coronavirus pep rally, the president abruptly left the briefing room, briefing over after a tidy 21 minutes or so. Back on the ground and in the real world we inhabit, this was a terrible day because the death toll passed north of 50,000 in our country, 51,523 to be exact, people who were all alive 3 months ago. Should things continue at this pace, in just a few days more Americans will have died from coronavirus over a span of 9 weeks than died in the Vietnam War over a span of 12 years. This afternoon in the Oval Office, after he dragged a Sharpie across a nearly $500 billion relief package, the president was asked about the devastating toll this virus has taken.
Do you take any responsibility for these 50,000 deaths that have happened in this country?
I think we've done a great job. Minimal numbers, we're going to be 100,000 people, and we're going to be hopefully far below that. If we didn't take quick action, you could have lost many millions of people.
As we mentioned earlier, today's White House pandemic briefing, the 46th such briefing in this crisis, was the president's shortest to date. And Axios tonight is reporting that Trump is planning to cut the daily briefings. Quote, a number of Trump's most trusted advisors, both inside and outside the White House, have urged him to stop doing marathon televised briefings. They've told him he's overexposed, and these appearances are part of the reason polls aren't looking good for him right now against Joe Biden. Axios adds that conversations about this were underway at the White House before yesterday's briefing. That's the one where Trump seemed to suggest injecting household disinfectants and inserting ultraviolet light into COVID patients. Today, with the don't try this at home warnings from disinfectant manufacturers, state and federal health officials piling up, the president was trying to tell us we saw something different. He tried to say he wasn't being serious.
Can you clarify your comments about injections of disinfectant? They're quite provocative.
No, I was asking a question sarcastically to reporters like you, just to see what would happen. I was asking a very sarcastic question to the reporters in the room about disinfectant on the inside. But it does kill it, and it would kill it on the hands, and that would make things much better.
Pandemic Task Force Coordinator Dr. Deborah Birx, who you saw earlier listening to her boss offer potentially life-threatening suggestions, was more forgiving today during an interview on Fox News.
When he gets new information, he likes to talk that through out loud and really have that dialogue. And so that's what dialogue he was having. I think he just saw the information at the time, immediately before the press conference, and he was still digesting that information.
NBC News, among those reporting Trump's comments about sunlight and disinfectants, stunned his close aides, catching them off guard. Our colleague Carol Lee is part of the team that's been working on this story.
Aides in the White House who just started texting each other saying, where did he get this from? Where's this coming from? And they were trying to figure it out. What we learned is that before the briefing, there was a meeting in the Oval Office where some of this was discussed, where the idea of heat and humidity and disinfectants being effective on surfaces, and that the virus doesn't live as long if in heat or humidity and those types of things, that had been discussed in the Oval Office. There was some discussion about how different ailments can be treated with radiation. And what Aide said is that the president seemed to just conflate all of this and ad-lib at the podium.
This all comes to the fore as one of Trump's other questionable potential cures is taking a big hit publicly. He has touted this anti-malaria, anti-lupus drug hydroxychloroquine as a game changer for COVID patients. But the FDA is now warning against its widespread use without strict medical supervision in a hospital setting. Over the past several weeks, states have built up stockpiles of this drug, despite cautions from medical experts that more research is needed.
We have purchased and we have stockpiled 29 million pills of the hydroxychloroquine, 29 million. A lot of drugstores have them by prescription. Our national stockpile is now equipped with nearly 30 million hydroxychloroquine pills. We're distributing them by the millions. Over the last 7 days, my administration has deployed roughly 28 million doses of hydroxychloroquine from our national stockpile.
Meanwhile, after weeks in lockdown and a day after we learned we have 26 million out of work and filing for unemployment, Georgia is one of a handful of states that today started allowing some businesses to reopen. Barbershops, nail salons, gyms, tattoo parlors opened their doors, even as Georgia reported now nearly 900 deaths from coronavirus. Iowa, which is also seeing increases in its virus caseload, is planning to begin reopening its economy on Monday. And finally, there's this. Mike Pence with Geraldo Rivera.
Do you think I'll be on my boat and fishing in early June, Mr. Vice President?
I think, honestly, if you look at the trends today, that I think by Memorial Day weekend, we will largely have this coronavirus epidemic behind us.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.